Welcome. Thank you very much for coming today to listen to my talk. This is part of the Integrative Women's Health course. Today's topic is on decreased menstrual flow, commonly known as hypomenorrhea, or sometimes we call it oligomenorrhea also as well. A typical case from Professor Xu in China is a 29-year-old who had an abortion, had a DNC 2 months ago, and her menstrual flow basically decreased dramatically in the last 2 cycles. So she came into the clinic. Her operation of a DNC was basically for abortion. DNC was non-eventful. There's really no complications, but now she just have this decreased menstrual flow along with some decreased vaginal discharge. Her flow has no clots. Her tongue is pale though. Her clothing is thin and white, and her pulse is thready and weak. So we will take a look at this case and how Professor Xu takes care of this patient. The definition of this condition is that the menstrual cycle is normal, but the amount of the menstrual flow decreases significantly, or the menstrual time is becoming shorter. Instead of just 4 or 5 days, now it's like maybe 2 days or less. Hypomenorrhea, as we know as a short or a scanty period, is one of the terminology to describe this condition. And this is usually is an extremely light menstrual blood flow. And the possible condition could be the uterus is injured, or overall maybe that the uterus is small, or there's a poor development of a uterus. There may be also sex hormone function decreases as well. It could be a pituitary function, hypothalamus function decrease, or operations. If there are pelvic surgeries and multiple operations, that might have weakened or damaged the blood flow itself. So in Chinese medicine, there's really 4 main etiologies associated with this condition. And there's about 4 syndromes. The very first is the kidney deficiency syndrome. The second is a blood deficiency syndrome. And the third is a blood stagnation syndrome. And the fourth is a phlegm dam syndrome. So let's go through them and take a look at them. First is a kidney deficiency. Well, this might be somebody who is constitutionally kidney qi weak. When they're constitutionally weak, a lot of time it doesn't nourish the Cong and Ren channel. Or that there is a situation where the kidney qi become weakened, could be because of fatigue, overstraining, excessive labor, excessive pregnancies, or even, Chinese medicine believe excessive sexual activity can actually drain your essence and weaken your energy. In all these situations, basically cause the Cong and Ren function, Cong and Ren channel become empty. So there's not enough blood to bleed, And the second situation, blood deficiency, this is more, shall we say, more common sense. If you don't have enough blood, then you don't have enough blood. So if you have blood deficiency, you're not going to have enough blood to bleed. This can occur in situations of chronic illness, somebody who is weakened over time because of chronic illness that can injure the blood production and transformation function in the body. So you have a situation where the nutritive part of the blood as well as the blood itself become deficient. Or that you could have a Cong and Ren deficiency where the hormone level is weakened, and that can actually create blood deficiency also as well. Now, poor nourishment is can be caused to poor diet, overdoing things, overstraining, overworrying can injure the spleen, cause the spleen blood production to be low. All this causes the sea of blood, which is Cong and Ren channel, to be empty. When that's empty, the menstruation amount become decreased. And then the third etiology is this condition of blood stagnation. Now, blood stagnation can occur in different scenarios. The first scenario is that there is exogenous co-invasion. There is an invasion of exogenous co causes a blockage in the Cong and Ren channel, The other thing is chronic stasis. This person may have a chronic stagnancy and stasis, and that can cause qi and blood stagnation as well. Now, with all the qi and blood stagnation, what has happened is that it can cause blockage of Chong and Ren channel, so the menstrual flow basically becomes hesitant and become blocked and become decreased. The fourth condition, the phlegm damp situation. Constitutionally, a person might be excessive phlegm damp, or that the phlegm can be blocking the channels and collaterals, and the blood becomes sluggish, or that the spleen lost its transforming function, collection of damp turning into phlegm. And so all these three situations can cause phlegm damp, can cause this blockage of the menstrual blood from basically having regular menstruation. So basically, if you look at the pathology, you can say differentiate. You got deficiency situation, you got excess situations. So the deficiency situation is basically your qi deficiency, your blood deficiency, and the qi deficiency is usually your kidney qi deficiency, and the blood deficiency usually your spleen blood deficiency. These two can cause deficiency of Chong and Ren qi of blood, and then lack of menstrual blood. The excess is not always lack of menstrual blood, but excess sometimes is more of a blockage issue. So excess can be seen in blood stagnation situation, phlegm damp accumulation situations. In this situation, Chong and Ren channel and qi of blood can become blocked, and therefore the blood flow becomes hesitant as well as sluggish. So basically, these are the two main areas of deficiency and excess that can cause this condition. And in diagnosis, the main symptom we will see is a decreased menstrual flow, but usually cycle is pretty normal. That means it's timely and it doesn't drag on forever. And then, or you can see combination of conditions. You can see menstrual cycle irregularity or combined with delayed menstruation when you have a decreased blood flow, for example. Or that if you have blockages, then you might be seeing some cramp and pain conditions. So when we look at examination, I think the very first thing we want to look at is maybe do a pelvic exam to check the size of uterus and to see if there's some kind of blockage. Ultrasound, we can usually see some uterine blockages, and we want to maybe look at sex hormone levels and even check for anemia, because these are some of the things that can cause the blood flow to be decreased. Basically, if you look at the symptom differentials, of course, all the quantity of the flow, it's going to be decreased. Now, in the deficiency, you're going to be having more pale kind of color. In the stagnation, in the excess kind of condition, you're going to have more purple, dark, except in the phlegm damp, a lot of time that is still pretty pale. That's still pretty pale. Now, in a kidney deficiency, in a blood deficiency situation, the quality of the flow is going to be more thin. Now, if you have a blood stagnation, so you're going to see clots. In a phlegm damp, you're going to see sticky, usually, while the cycle most of the time appear normal for all of them. So basically, what we want to do in treatment principle-wise is that we want to regulate uterus, Chong and Ren, and qi of blood. When we have kidney deficiency, we want to strengthen and tonify and nourish the kidney. If we have blood deficiency, we want to strengthen the qi, nourish the essence, nourish the blood. If we have blood stagnation, we want to warm up the channel and circulate qi. If we have a phlegm damp accumulation, we want to try to dissolve phlegm. So that's the main treatment principle for these four syndromes. So let's go deeply into these four situations and look at the herbal therapies. So kidney deficiency comes to be the first one. This is a situation where you're going to see decreased menstrual flow. You're going to have pale or dark red color flow. The flow is going to be thin. There will and usually have some dizziness, ear ringing, back pain. The knees are weak. Heels might be achy. The pelvic might be cold, and there will be usually nocturia, and the tongue is usually pale. The pulse is usually deep, weak, or deep, slow. So this is a typical kidney qi deficiency. Chong and Ren qi of blood is deficient. So our goal is to tonify kidney, benefit the essence, nourish the blood, regulate the menstruation, And we usually would use a formula called 归肾丸. 归肾丸. 归肾丸 is a composition of 菟丝子, 杜仲, 枸杞子, 山茱萸, 当归, 熟地, 山药, and茯苓. Now, if there's yang deficiency, we can add 仙灵皮, we can add 八极天, we can add 仙马. If there is indeficiency, we can add 生地黄, we can add 女贞子 and 玄参 into the mix. If there is internal heat, we can add 丹皮, 鸡子, gardenia, or 知母 into the mix for treatment of this condition. Now, let's go into herbal therapy for blood deficiency. In this syndrome, you will see symptoms of decreased menstrual flow, and the color is usually pale, and there is usually dizziness, blurry vision, palpitation, and the face is usually sallow, and there is pelvic empty feeling, like a prolapse empty feeling, and while the tongue is usually pale and the pulse is usually thready. And this is a situation where the Chong and Ren sea of blood is deficient and empty. So therefore, what we want to do in treatment principle is to nourish the blood, benefit qi, and regulate menstruation. And 滋血汤 would be an ideal formula for this. And 滋血汤 is a combination of 人参, 当归, 黄芪, 山药, 茯苓, 川芎, 白芍, and 熟地. So you can see definitely has quite a bit of qi tonic along with 四物汤 into the mix. That's 滋血汤. If there's insomnia with palpitation, we can add 夜交藤, 五味子, or 酸枣仁 into the mix. If there's a poor appetite, we can add 砂仁, 陈皮, 白术 into the mix. So let's go on to herbal therapy for blood stagnation. In this syndrome, you will see decreased blood flow, purple dark flow, and they usually have clots, and they are going to have pelvic distending pain, definitely aversion to pressure since this is an excess condition. If there's a release of clots, it will reduce distension and pain. And the tongue is usually purple dark, pulse is usually thready and wiry. This is a situation Cong and Ren channel is blocked. The blood flow is hesitant and sluggish. Therefore, the menstrual blood flow is blocked. And so what we want to do in this situation is activate blood and dissolve stagnation. And a typical formula for this would be 桃红四物汤. And that's a combination of 桃仁, 红花, 当归, 熟地, 川芎, 白芍. And sometimes you can substitute 赤芍 for 白芍, for example. Now, in this, if there's a qi stasis that's quite strong with a blood stagnation, we tend to add 香附 and 乌药 into the mix. If there's cold condition, cold contracture with a blood stagnation, then we want to add 桂枝 and 吴茱萸 into the mix. Now let's move forward to the herbal therapy of phlegm damp. This is a situation we have decreased blood flow. The color is pale. It's a sticky, thicker flow. And we can see this condition in people who might be overweight or obese. There's chest distension and nausea. There's vaginal leukorrhea, fatigue. Tongue is usually pale. Coating is usually thin, white, and greasy. And the pulse is slippery. And this is a situation where the phlegm damp is blocking the Cong and Ren channel, causing sluggish, hesitant menstrual blood flow. So we want to dissolve the phlegm. We want to dry up the dampness, and that in turn will help us to regulate menstruation. And a very famous formula of 仓护导痰汤 is ideal for this situation, which is a combination of 苍竹, 香附, 半夏, 茯苓, 陈皮, 甘草, 胆南星, 止咳, 生姜, and 生曲. These are some of the herbs that's very, very helpful for this phlegm damp condition. Now, If the menstruation stops or completely stops, or where you have amenorrhea, then we need to add something to move the blood a little bit. So we might add 当归, 川芎, and 泽南, and 川牛膝, for example. Acupuncture treatment are used quite extensively for this condition. For example, for blood deficiency, we could use a tonification method, selecting points such as bladder 17, 15, stomach 36, spleen 6, spleen 10. If we are treating for kidney deficiency, we can use conception vessel 3, governing vessel for bladder 23, conception vessel 6, spleen 6, spleen 10, tonification for kidney deficiency. Now, if we have blood stagnation, we will use bladder 17, large intestine 4, liver 3, spleen 10, liver 2, spleen 6 in sedation for this condition. Now, if we are treating phlegm damp, then we can use points such as conception vessel 3, stomach 36, stomach 40, spleen 9 into the mix. And we'll do a sedation method for this kind of condition. And we can also use auricular points, things like ovaries, things like uterus, things like liver, sunjaw, and pelvis can all be helpful. So there are other cautions that I want to bring to your attention during menstruation. Adding some blood activating herb in this situation can be helpful since the blood flow is scanty. You don't really have a worry about that the blood flow might become excessive. So you can comfortably add some blood activating herb, especially during menstruation. Now, during the outside of menstruation, our focus should be on fundamentals of their fundamental condition, such as on nourishing their essence and the blood. Now, stay away, if you can, from astringent herb if it's possible, because astringent herb actually can stop the flow even more. So coming back to this case of Dr. Xu Rui San, the case, 29 years old, woman had an abortion, D&C, 2 months ago. Her menstrual flow has decreased dramatically, last 2 cycles. Even though her operation was non-eventful with no complications, she is now having decreased vaginal discharge, no clots, tongue is pale, clothing is thin white, and the pulse is thready and weak. So this is a situation of liver kidney insufficiency, 冲任 insufficiency. So what we want to do is this is a combination of kidney and blood deficiency. So we're going to use herbs such as 党参, 当归, 川芎. We add a little bit of 鹅足, and we have 熟地, 首乌, 香附, 川牛膝, 白芍, 益母草, 7 bags daily for one week. So on the second visit, the blood flow, her period blood flow seems to be improved, but she's still tired and dizzy, and her pulse is thready and weak. So Dr. Xu changed the formula to have 仙柠皮, 仙茅, so it's more young tonic now. 拔几天, 女贞子, 女贞子, 沙苑子, 枸杞子, 菟丝子, 紫河车, 首乌, and 续断, as well as 香附 and 益母草 into the mix. So you can see that this is a condition where that he's trying to add some blood activating herb in it, but also some young tonification, and that seems to work very well. Dr. Xu was born in 1926. He is one of the chief physicians in China-Japan Friendship Hospital. He's a lifetime professor of the Beijing University of Traditional Chinese Medicine, and his focus has been on infertility, endometriosis, and tubal blockages. So thank you very much for your attention today, and I hope to see you next time.